Today we're going to talk about chiropractic care. I'm here with Dr. Juan van Breda, and he has been my chiropractor for probably 25 years. Welcome.
Thank you. That's fantastic.
I have a memory being very far pregnant with my son, who is here today as our videographer. And we've had a Rottweiler that refused to leave the house. And I pulled the Rottweiler and pulled my back out. And I mean, you know, to be far pregnant, you can't lie on a bed and get your back manipulated because it's like a seesaw. So you sorted me out even in that state. So I've been very loyal ever since.
Well, thank you. Yes. Well, wonderful. We could have helped. And being pregnant, it's a very special situation. As you say, you can't just easily go lie down on the chiropractic table with the abdomen being so distended.
It is large,
we had to use some different methods. And if you had good results, and the nice thing is we keep all our records, so everything is archived. So we'll have all that written down. We'll be able to actually read back to that precise consultation, know everything that you told me, and everything that we had to test, everything we did for you.
And I think what I do like to say is that if you've had a bad experience with a chiropractor, don't get put off by chiropractic care, because there are various different techniques that chiropractors use. Not all chiropractors practice in the same way.
Right. Certainly, Dillian. In chiropractic, we have a number of what we might call them major techniques. And there are also a number of lesser techniques. And I can't really comment much on the South African institutions, but say in the United States, where the main chiropractic colleges are, if you go to the any specific college, they get you to most probably train in maybe about 4 or 5 of the major techniques, which is what they call their core curriculum. And it varies between some of the major colleges as to which of those techniques they've chosen to make up that core curriculum. And then whilst you're there, they'll offer you as they often call it an elective. We actually choose out of the menu of some of the lesser techniques. So you'll do your core curriculum, which everybody out of that college has to master, and really, to graduate, you have to come out with a high degree of skill in all of those, say, 5 major techniques. And then depending on what you choose, you'll do all the electives, which would be like extra afternoon classes and evening and weekend classes. And you can, in a sense, create a rather sort of tailored academic program to suit what you think you'd like to do later in practice.
Right.
And then added to that, there are a whole lot of even lesser chiropractic techniques which will often be offered by outside institutions. So predominantly in your weekend time, you'll go and attend extra classes. So you can build up, say, basis of all kinds of different skills which help you later in practice. And it's the type of thing that might be certain skills you would use like on a brand new newborn baby, and there might be some of those others which you would only be able to use like on a 98-year-old very osteoporotic old lady.
Right.
And then in between there'll be specific techniques which might be great if you're dealing with sportsmen and rugby, so like we'd call it rugby players or American football players, who like your young guys who whatever 140 kilograms and 6 foot tall and just all muscle. So with that we can use different things which would be more appropriate to different patients. So that's the basis of chiropractic.
So it's not one technique fits all.
No.
Is that where you qualified in the States?
Yes, correct. Yeah. So typically, if somebody came and said, "Well, I've been really traumatized because the chiropractor was too physical," one would think really that they haven't really applied the technique correctly, because even with the call it more physical adjusting techniques, as we call them, if you do them correctly, there isn't a whole lot of force. And a patient should really never feel traumatized. That I think that would be an unusual experience with chiropractors really practicing correctly.
Who is the founder of chiropractic?
Okay, so well, he was Dr. Daniel David Palmer, and he was practicing in those days what they called magnetic healing, which is really, I suppose, in modern language, energy healing, and practicing in Davenport, Iowa, which is a little town in Iowa in the United States, right on the banks of the Mississippi. And the history is that his practice was in I think a 2 or 3 story building in this town. And one day the chap who was the janitor in the building came to him and said, "Look, I'm losing my hearing." And part of the history of the story of him losing his hearing, apparently he was bent down under a stairway, like I suppose in like a storeroom or something, under stairway in an awkward position, bent, I think apparently lifting something heavy. He felt like a click in his neck, and he then got neck pain and started to notice this loss in hearing, and he ended up going to see Dr. Palmer as such, and I suppose most probably they saw each other every day in passing because he was working in the same building. And Dr. Palmer at that stage thought, well, that's interesting. He described that he had this sensation of a click or pop in his neck, and that resulted to his hearing loss. And I suppose at that stage, knowing enough about the anatomy of how the cranial nerves run from the upper part of the neck, Dr. Palmer said, well, putting that story together, if something clicked out of place, it's now putting pressure on that nerve which affects hearing. If I can establish what it is, in the sense the vertebra clicked out of place, work out how this thing is clicked out of place, and if I have some way of working out how I can call it correctly align it, in other words, undo that twist and that click and that pop, and get it back to normal. If we can get the pressure off that nerve and that nerve starts to work normally, we can restore this guy's hearing, we've had success. So it was that train of thought which led to him getting hold of this guy and most probably delivering at that point what was the first chiropractic adjustment, correctly alignment of that neck vertebra popped out of place, and this guy ultimately having his hearing improve. And Dr. Palmer said, wow, there's something here. And that was really the birth of chiropractic on the 18th of September 1895. So
sure. You know your dates.
Well, that sticks, yes. Yeah.
So I can understand that you can manipulate a baby's spine with the techniques that you use.
Yes.
And it seems like fairly easy. In comparing it with a huge rugby player lying on your bed, you're not a massive big man yourself. So this guy has pulled something out of joint. How on earth do you work with that?
Okay. So, well, firstly, the word manipulate, chiropractors don't like that. Officially, we do chiropractic adjusting, which is very different. Most manipulations are what they often call long lever, and they have gross movements. In chiropractic, manipulation has never been part of chiropractic, never will be, because it's a whole different thing. And in chiropractic, I say the big drive is to that preciseness of diagnostic assessment and the preciseness of the correction. So that's a very, very different thing.
Explain this to me physically, if you can.
Okay. Let's just go back to that sort of basic chiropractic consultation. So we start off with, and you might remember all those 25 years ago, we had you fill out a history form. So with that, we gather information about as much as you can remember, everything through your whole life that ever happened to you in terms of your health, of injuries, of accidents,
how many times you've fallen, and surgeries and the whole thing.
And even pregnancies, because all of these things have an impact on your present situation. And so we start to get a picture of what's happened historically. Then you might remember in that history, we eventually come to saying, like, right now, what's your present concern? And typically somebody came on the door, not because they fell off the horse 20 years ago, but right now, today, there is that back pain on the sciatica or the splitting headache or the whatever. So first we get to understand everything that happens through life. Then we get to find out what's troubling you right now. And on the way, we try to ask pertinent questions to fill in the gaps, because most people will forget a lot of information. That's, I think, part of the beauty of our human nature is we delete unhappy memories. It's only with sometimes a little prodding they suddenly say, oh, I forgot to write down, but whatever, I was a student at university and my friend was driving and we crashed into the side of the bridge or something. So eventually that comes out.
Right.
And then the next step is we go and do a very careful series of tests and examination of the body to get more of a direct understanding of what's happening there physically. And we correlate it with all the story that's come to us so far. And then from there, we get to understand exactly how let's say it's a vertebra we're dealing with, how it's distorted from its normal position. And that's that word subluxation we used previously. And we get to understand, well, this tipped and twisted that way, it rotated there, it locked like that. And then we also look, does this correlate with what the patient's told us? We then go back to that process of what we call utilizing some chiropractic technique, of which there are many, as we were saying earlier, and which is appropriate to that time, that person and that type of injury and the particular problem. And that's how we get to, in that chiropractic sense, adjust and correct.
So you're adjusting something back into its original
and
position.
Restoring it also its function. So
right.
So typically, once we displace a structure, it tends to become fixed or locked in the incorrect position. So we not only want to get it in its correct position, we also want to restore the function of the joints. And the wider ranging consequences of that, say especially with the vertebra, they have the nerve roots passing out between them, the spinal cord is housed in the canal at the back of the vertebra. So one of the bigger objectives is to restore neurological function. So we start to look at it from a more holistic perspective rather than that purely this is a structure or a bone or a vertebra is out of place. We just pop it in simple terms back into place. We actually want to restore function.
So
and
that's
health.
the manipulation part.
No,
if you pop a shoulder back into place.
Just randomly, if you just wrench on it without
Right.
really understanding how it's been injured,
Right.
what's happened, and you take, let's just say, a wild shot at, let's just wrench around and see maybe it'll pop back. I think that would fall in more in the manipulation realm.
Okay,
Whereas the chiropractic adjustment will say, yeah, we got to understand how this thing got injured. The person described to me whatever. I was walking on a wooden floor in my attic. The floor timbers were rotten. I fell through. I grabbed, and my arm got wrenched that way.
Right.
And now I can't lift it. I have pain. And then we would have gone and checked and assessed. And we wouldn't only look at the joint, the shoulder joint in isolation. We'd start to look wider. We look at what's happening with the shoulder blade, the collarbone, everything else that relates to that. And then we come up with a way of understanding if that's exactly the injury and what we find here correlates with the story the person told us in terms of how they injured it. And we know it's out of place in that position, we can adjust that and correct its position, restore function, and we should get, call it, good results fairly quickly. We start off with that unique individual, and there's no other person on the face of the earth that is the same as that person. And then, let's say right from birthing, we were talking earlier about birth trauma, so right in birthing, that person may have been injured a particular way, which now influences them to this point in time. Then on the way, there was crawling and maybe crashing down a few stairs and learning to walk and falling over a few times. And then if you were still alive, they said to you, here's the thing called a bicycle, jump on this and see if you can kill yourself. Now, later came the horse and the motorbike. And it's very specific to the patient and influenced very much by the life story. So question of muscle memory, in a sense, the muscles don't really have a memory, but any kind of a traumatic incident affects, call it, everything else related to that structure. So if we go back to bone structures, they are approximated and kept in place by ligaments. And so if we go and, let's say, wrench any kind of joint in the body, we can actually cause direct ligamentous injury. We can even tear the ligaments, or certainly cause like a pulling of the ligaments.
Jean, how would you deal with an osteoporotic frail lady or man?
Okay, that's a good question, because we have, certainly in our practice, an aging population, and they end up with aches and pains like anybody else, and they need help. And in chiropractic, as I had said earlier, we have a number of different chiropractic techniques. So there's various techniques which are almost no force. And so some of these, especially more in the aging female population, because postmenopausal, as the estrogen wanes, they're set up for loss of bone mineralization, and they become so fragile that if we literally had to do anything by hand, we'd almost crush or collapse a vertebra. There's a risk of doing that.
Sure.
And so then we have various chiropractic techniques that are very, very light, they're almost no force, and we can do things from a chiropractic technique called sacral-occipital technique. We use special wedges we place underneath the pelvis and underneath the body.
Right.
So we can use those. So the person literally just rests on those. There's no real adjustive force. It's just the weight of the body resting on these.
It's not
wedges.
something you're not telling me, because you've put me on those wedges.
No, you're not osteoporotic.
I'm not menopausal or osteoporotic.
But we use the wedge.
So you use the technique for other people.
Yes, so but for somebody who's osteoporotic, there are a lot of things that we would do with you, or a young healthy person, we wouldn't do with them. So the oldest patient I ever looked after was an old lady I looked after until I think she was about 99 in the end. But she was severely osteoporotic, and we knew that from X-ray evidence.
Right.
So there was just no ways we could work with her using some of the more sort of chiropractic techniques which use a little bit of a force or impact. So we could do very, very gentle work with her. So that technique called sacral-occipital technique is very effective for that. And
so you literally have the person lying
on the table
with assistance.
Yeah.
and then you gently slide the wedge,
yeah.
which is just like a normal door stop but bigger.
Yeah.
Wedge,
That's it. Yeah.
right? And then it moves the spine
It acts as
into
a
an
fulcrum.
adjust.
So with the body weight resting on it, creates like a tipping or twisting of that particular structure.
And they lie there for a certain amount of time to adjust.
Yeah.
See why I go to him? He's gentle.
Thank you. And then we also use it's an American invention called an activator adjusting instrument. We can use that, and we can adjust the force with which it works. So we can make that fairly gentle. And we have some very gentle light pressure techniques we can use with our hands and our fingers. So a number of different approaches we can use. We that's at call it the far end of life. But I say even with the babies, as I was saying, they don't have a fully formed bone structure such, so that what they have is very, very delicate. And they literally work most times just with our fingertips. So we're using very subtle light force there as well. So that older end of the life spectrum, we're having to use light force because of loss of strength of the bones. But the bones haven't really fully developed, and we're having to be very, very gentle. And babies are most probably the more intricate and the hardest part of practicing chiropractic. A lot of chiropractors won't adjust and won't see babies as patients at all. So typically one has done extra courses in infant or baby type adjusting techniques, and so a lot of chiropractors they'll refuse to see a baby because they haven't done those extra studies, so they'll stay away from that. So out of everything, the babies are maybe the more intricate and the hardest. They're the biggest challenge, and some of them, because they can't listen to you and they can't understand, so some of them squirm around quite a lot. It makes it even more difficult to get to know what's going on, and then ultimately to get to adjust them. So
let's say that you are a normal young student at university, and you spend a lot of time sitting forward studying or in front of a computer and playing team sports and so on. At what point do you go to see your chiropractor other than the extreme, I can no longer turn my neck? Is it something, because I know that one of the first things you look at is the feet. When you lie down, do you have one leg shorter or longer than the other one? Is that something that students could just, or a parent could just check and see maybe now it's time for you to have an adjustment?
Well, that's just one of the assessments we do, and it's like a starting point often, because we do lie the patient typically down onto our chiropractic table, and we get them, if they relax there for a minute or two, go and start to look at the assessment and the symmetry of the body. That's one of the easy ones. So we have a number of patients, so they will be families who are patients, and then the mom or the dad will come and say, well, Johnny told me his back was sore, so I said to him, lie down on his bed, and I pulled the legs out, and I see this is completely skewed. So I said to him, tomorrow you have to go to the chiropractor. So we get some of the parents or even the siblings doing that to each other, because they're
I've done that with all my children.
So we often have, if a family comes to see us as patients, and like mother's there, and the kids will always come in with us, see what are we doing, or if the child's the patient, the mother always come to be part of the consultation, so they get to see what we do. So from this they take some lessons home.
I must tell you probably don't want to hear it, but I've regularly adjusted my children's backs.
Okay, you didn't tell me that part
I
before,
know.
but that's look how good they are.
I have gently done
I
a
hope I
little
was
bit
a
of your
good teacher.
movements. You were a very good teacher. They were fine afterwards. They clicked when they needed to click, and then they never cried or screamed at me, so it must have been okay.
And none of them died on the table.
That
was successful. The patient got up at the end of the
consultation. It's better than them falling off a horse or a bicycle. So I could have hurt them that badly, but no. So you can do a lot at home. You can do self-assessment, and you can do gentle aligning of the spine with gentle movement. My question to you now is, when do you apply heat and when do you apply ice? Because I got it the whole wrong way around the other day.
Okay, now going back to that question. So typically, if one has a long-term chronic problem, so an example would be, say, rheumatoid arthritis, and those joints really sort of inflamed and arthritic with rheumatoid arthritis, one would think then about using sort of a warm compress. And then if it's an acute injury, then typically cold is better. So just a quick, easy way, if it's like acute and it's something that's just happened, it's really injured, it's traumatized, cold will be better.
Right.
And then for those long-term chronic things like osteoarthritis, rheumatoid arthritis, then you must really think about using a warm compress.
Because I called you, I was sitting at the desk, I've been sitting at the desk for like 18-hour days,
Wow.
and I had such low back pain,
Yeah.
and I kept putting hot water bottles on it.
Yeah. Yeah.
And it just got worse and worse
Yeah,
and worse. And obviously you make it more pliable and you make it more out of line.
Well, yes. One of the things is, especially with the low back, with the sacral-iliac joints, we were saying earlier that any joint in the body is kept in place by ligaments. So if we heat the ligaments up, we make them more pliable and elastic. And if it's a big weight-bearing joint, then you jump up and move around. There's more chance that you would have it get worse.
So ice it,
So,
not hot water bottles if you've got an
so
acute pain somewhere.
So first choice would be to use a medical ice pack. So they, even at whatever about freezing point, they remain pliable, so they mold to the body. And then also the important thing is never put that directly onto the skin, otherwise we'll then get an ice burn.
Right. So not just be cautious of the hot water bottle, but also the ice pack.
Yeah, well, people with hot water bottles sometimes come with big burn marks on their back, and they say my back's so sore and the skin's so sore, but they can't see there.
Right.
And then
Oh,
they lie down and have a look and say, but this is all red and
Did they
blistering
fall
and
asleep
scalding.
on the hot water bottle?
Well, sometimes they do. They say their t-shirt or their sort of night dress came up, and they were lying there on this thing and fell asleep, and they didn't realize it was right against the skin. And then I've had it also with diabetic patients, because especially diabetic patients lose sensation.
Yes.
And then
very
they
true.
will say, "Oh, my ankle was so sore," and I rested on a hot water bottle, but they have no idea that they're
How
burning the
hot it
skin,
is. And they take so long to heal those
forever.
injuries as well.
Yeah. So I've had some serious injuries with diabetic patients with heat, and they just had no idea that they were actually burning themselves.
Wow.
So
It's good
so
to
that's
know.
a rather special sort of area in terms of diabetic patients. But most of them nowadays are well informed. They know how to care for themselves and be careful. But still, the odd mistake happens.
Yeah, well, this is very valuable. There's so much more questions I have for you, but we
can
have
go
to.
forever.
We can. I do want to talk to you about kinesiology and the
yes.
link with chiropractic, but we have to unfortunately invite you back for another
Okay,
episode.
I'll have to drive all the way to Franschhoek to come and do this
Yes,
again.
yes.
Okay, thanks, Delia.
That was really lovely having you. Appreciate your
thank you so
time.
much. Well,
I
thank
know
you.
how busy you are, so thank you.
No, I'm just disorganized because patients are random happenings.
You always give, you give and you give, and you let
thanks.
your patients run your life.
I think that's part of being in service to people. That's part of, I think if you're going to be a good healthcare practitioner, you can't suddenly say, well, it's Sunday, I want to go and paddle my paddle ski and do my 15 kilometers on the ocean. And that person phones and says, well, I didn't sleep for the last 2 nights.
Sure.
Is there anything you do to help me? So in a sense, I think it's not a profession, it's not a job one does, it's actually a calling.
I admire
So
that in you.
Thank
Very
you.
few people like that. Thank you.
Thank you. Thank you. Thank you for that. That's special. Thanks.
You're a special human.
Oh no, that's so kind. Thanks. Yeah.
Thanks,
So
John.
great.